be honest, no matter who you are, confidence matters. And whether it's your professional or your personal life, you always want to look your best. Here to talk about safe ways to tuck and trim those trouble spots is board-certified plastic surgeon, Dr. Thomas Jeneby. Dr. J, as I call him. Welcome to Great GDSA.
Thank you.
You're looking good.
Thank you.
You're looking good.
Thank you.
Thank you for coming. I was thinking, this is January, February, spring's almost here. Us ladies it's crunch time.
Lake season.
Almost bikini time.
Yeah.
You got to do it right. You want to look right, you want to look tight. That's why we brought you here this morning. Dr. Jeneby, a lot of things going on at your place. I want to begin by talking about this wonderful thing called Viora.
Viora, yeah.
Viora. Yes, what is that exactly?
It's a brand new laser. Just came out, just FDA approved for wrinkle reduction, cellulite, and overall skin tightening with no downtime.
And do you find, Dr. J, that no matter your age, your race, your weight, if you're a woman, you're going to have some cellulite?
Cellulite is basically genetic.
Yeah.
I don't care how many times you go to the gym or whatever. Anybody tells you need help with cellulite.
So we're looking at this after here. What's happened to her? Has she gone through the Viora?
She's gone through the Viora. She's been in about 4 treatments. There's about 8 in a package.
Okay.
And
So
there's no downtime. You just come in for 20 minutes. It's kind of like a hot massage type of deal with a handpiece.
There you go. That might take you from a one-piece to a bikini right there, the
Hopefully.
Viora treatment. Okay, here's another thing that's pretty popular right now called the adjustable breast augmentation. There was a time you thought if you got an augmentation, you had to just live with what you got. Not anymore.
Yeah. It's my 10th year doing them.
Yeah?
And I like them because it's basically custom. After surgery, women have breast remorse. They wish they'd gone bigger, and some wish they'd gotten them smaller. Mostly bigger. And
Yes.
This is Texas.
They
Let's
go,
get it,
I wanted something to fill me out a little more. This is Texas.
I mean, very few want them smaller. But,
want to go small. So what is this? You adjust, it's like it sounds, it's adjustable.
yeah, so I put a small device into the skin for the first 6 months, and it's temporary. And you come back at the 3rd month after surgery, and we start placing fluid in there through a device which is hooked to the implant.
Okay.
And then the device comes out at 6 months under local in the office.
Okay, so if you aren't happy initially with what you have,
And everybody's not really that happy in the beginning.
that's right, because it's a
Really,
first-time
pretty
thing,
much.
isn't it?
Yeah,
Okay,
yeah,
this one is ever popular, the tummy tuck.
Yes.
Yeah.
Yeah.
Now, how many? I wanted to ask this because I had this question: is there too much tummy that you can't tuck? Like, I mean, who's the best candidate? Who's the best candidate for this kind of
Believe it
procedure?
or not, there's too little tummy. Sometimes people come in
Really?
and they don't have enough, and I actually make them either gain weight or do something.
Work out, yeah.
Basically, I need a lot of skin. The more skin you have, the better it'll be. And if you're kind of not in that category, there's a mini tummy tuck
Dr.
for
J,
those.
this is dramatic. How long after the procedure
Well,
was this after?
This lady here actually had a gastric bypass surgery first. Because I wouldn't do it on a person like this. This is before gastric bypass.
Okay.
Then she lost all the weight. Then she gave me loose skin. And if you look at the top left, she also had an axillary and breast lift. Axillary-plasty with brachioplasty, arm lift, axillary.
Now you're talking doctor on us.
Sorry,
None of us know what an axillary.
Right beside her
Axillary.
breast, that little area beside the breast, and right near the arm too. But she had a full, what they call full body lift type stuff.
Okay, now take us to good old-fashioned lipo. Yes, lipo where the fat is removed.
Right.
Yes.
Liposuction has evolved. Now we have smart lipo or laser lipo, which I brought in 2007, and it uses heat combined with regular lipo. So you get 2 types of lipo at once. It can be done under local or general now in my office because I'm Joint Commission Certified Operating Room.
Wonderful, Dr. Jeneby. And you're also very involved in the community. You guys have something going on soon?
Yeah. We actually have St. PJ's today, but we also have a giveaway. The first 10 callers get a free Viora treatment.
Oh, did you hear that, ladies?
First 10.
Pick up those. Yeah. You want them to call?
Yeah,
Dr.
they can call right
Jeneby's?
now. First 10 callers only.
Okay.
Call us for a free Viora treatment, 1 treatment.
Okay.
To come in and check it out.
And you want them to call your office?
Yes, I do.
At 210-270-8595. First 10 callers, Viora treatment. Can somebody start calling for me? Stay with us. We'll be right back. Call for me, Ralph. Call for me. Call for me. Does that count?